Vitamins and iron are vital for the proper functioning of our bodies. Vitamin B12 is essential for nerve function, DNA synthesis, and red blood cell production. Vitamin D is crucial for bone health, immune function, and mood regulation. Iron is necessary for oxygen transport in the blood and energy production. Without an adequate intake of these nutrients, our bodies can experience various health issues. Stay tuned to learn how to optimize your nutrient intake and safeguard your health. Vitamin B12, also known as cobalamin, is a crucial nutrient vital to various bodily functions. In this segment, we will explore the causes, symptoms, and consequences of vitamin B12 deficiency, shedding light on the importance of this essential vitamin. Vitamin B12 is essential for producing red blood cells, which carry oxygen throughout the body. It also plays a crucial role in maintaining nerve health and supporting the proper functioning of the brain. Without an adequate supply of vitamin B12, these vital processes can be disrupted, leading to various health issues. Several common risk factors can contribute to vitamin B12 deficiency. One of the primary factors is diet, as vitamin B12 is predominantly found in animal-based foods, such as meat, fish, and dairy products. Vegetarians and vegans are at a higher risk of developing a deficiency if they do not supplement their diet with vitamin B12. Additionally, as we age, our bodies may have difficulty absorbing vitamin B12 from food, increasing the likelihood of deficiency. Untreated vitamin B12 deficiency can have severe consequences for our health. One of the most common outcomes is anemia, a condition characterized by a lack of healthy red blood cells. Symptoms of anemia include fatigue, weakness, and shortness of breath. Long-term vitamin B12 deficiency can also lead to neurological problems, such as numbness and tingling in the hands and feet, difficulty walking, and memory loss. By understanding the causes, symptoms, and consequences of vitamin B12 deficiency, we can take proactive steps to ensure optimal levels of this essential nutrient for our overall health and well-being. Stay tuned for more insights on how to address and prevent vitamin B12 deficiency. Vitamin D, often called the sunshine vitamin, is a crucial nutrient that significantly maintains our overall health. In this segment, we will provide insights on recognizing, treating, and preventing vitamin D deficiency, ensuring optimal levels of this essential vitamin for our well-being. Vitamin D can be obtained from various sources, including fatty fish, fortified dairy products, and egg yolks. However, one of the primary sources of vitamin D is sunlight exposure. When our skin is exposed to sunlight, it produces vitamin D naturally. Spending time outdoors, especially during peak sunlight hours, can help boost our vitamin D levels and support overall health. Vitamin D deficiency can manifest in various ways, including fatigue, muscle weakness, bone pain, and frequent infections. Inadequate levels of vitamin D can also significantly impact bone health, leading to conditions such as osteoporosis and increased risk of fractures. Furthermore, vitamin D plays a crucial role in supporting our immune system, and deficiency can compromise our body's ability to fight off infections. If you suspect you may have a vitamin D deficiency, there are practical steps you can take to address it. Increasing vitamin D-rich foods such as salmon, tuna, and fortified cereals can help boost your levels. Vitamin D supplements are also available for those who may have difficulty obtaining enough vitamin D through diet and sunlight exposure. Consulting with a healthcare provider to determine the appropriate dosage is recommended. By recognizing the signs of vitamin D deficiency, making dietary adjustments, and considering supplementation when necessary, you can effectively manage and prevent vitamin D deficiency, promoting optimal health and well-being.